Good morning, good afternoon, good evening, everyone. My name is Raquel Wexler. I work in the Office of Innovation at UNICEF, and I would like to thank you all for joining us today on this global webinar on lessons learned and good practices in programming with mobile tech solutions to improve the lives of children and adolescents. This is about strengthening national real-time monitoring e-systems with RapidPro in support of digital WASH, health, education, and social protection initiatives. So as you all may know, this is a multi-country initiative which involves some 11 countries which are supporting national real-time monitoring e-system strengthening with RapidPro. And it's been jointly supported by regional offices, particularly the UNICEF Middle East and North Africa Regional Office, the South Asia Regional Office, and Eastern and Southern Africa Regional Office, as well as headquarters divisions, including the Information Communications Technology Division, the Program Division, the Field Results Group, and the Office of Innovation. So we have a number of colleagues who are joining us to present their experience and lessons today. And I really want to thank them because they've been hard at work with our national partners in planning and implementing national real-time monitoring system strengthening initiatives. And they're going to be speaking of their country experience today. Each of the colleagues has been asked to introduce herself or himself before speaking. And of course, there are many others who are not on this list, who include many other regional colleagues, particularly the regional ICT4D business analysts and other program and planning colleagues who've been supporting country work along the way. And I'm with my colleague, Evan Wheeler from our Information Communication Technology Division, who will help moderate this webinar. I should also mention that we have opened this up to external partners, so I'm trying to be as clear as possible when and not mention acronyms like ICTD, etc. In terms of the agenda, so first we'll begin with an overview of the rise of digital mobile tech platforms in programming and UNICEF's National Real-Time Monitoring Systems Strengthening Initiative. So today, country offices will be sharing their results, their lessons, and good practices following 1 year of implementation of this initiative. And again, I just want to stress we're at 1 year of implementation of this initiative, but we're already beginning to see results across countries, and we have been learning lessons along the way. So country presentations will be undertaken by the country offices from Pakistan, Nepal, Zimbabwe, Uganda, and Jordan, which have been working with national partners to support system strengthening across sectors, including water and sanitation, health, and social protection. So the idea is that each country will be providing a presentation of approximately 8 minutes each. And after all presentations are concluded, we'll open it up for question and answers. At the beginning, I and Evan will be presenting on the overview for about 8 or 9 minutes or so. So with that, let's proceed. So as you know, innovation in UNICEF and in our work with national governments is not new. And in light of the scale and the speed of humanitarian and development challenges, we in UNICEF, we have to adapt our programs to the evolving problems that are affecting children. And we are asked to innovate and find new ways to accelerate results for children and reduce inequities using proven solutions. And the UN and global development partners, they've been asking for a revolution in data and how we collect and how we use and how we manage program information and how we strengthen transparency and accountability to citizens through real-time information. And the proliferation of information and communications technologies, or ICTs, has created enormous opportunities for UNICEF to advance our programming. Today, there's some 7 billion people, or about 95% of the global population, living in an area that is covered by a mobile cellular network. Mobile phone penetration is really transforming the delivery of essential services and offering new channels to reach families and frontline workers, many of whom were previously disconnected or hard to reach. And the rapid expansion of mobile telephone ownership has fundamentally changed the way government partners design and implement and monitor and assess their sectoral programs in support of the Sustainable Development Goals. Our country offices are also reporting increasing use of information and communication technologies by government partners across sectors and asking for UNICEF for support in this domain. As digital solutions become increasingly mainstream, these innovations provide UNICEF and our partners a unique opportunity to support the building of robust integrated national systems which are enhanced by real-time digital monitoring and communications technologies. And introducing these types of mobile technologies in our programming using the open source platform RapidPro is just one of these innovative solutions.
Thank you, Raquel. My name is Evan Wheeler from UNICEF's Information and Communication Technology Division in New York. Thank you for being with us today. As Raquel mentioned, RapidPro is an open source software system that UNICEF introduced in 2014 that allows for the easy configuration of mobile services that can engage beneficiaries, staff members, and partners through mobile channels such as SMS, social media channels like Facebook Messenger, as well as custom mobile phone applications. RapidPro is also used to power UNICEF's U-Report platform, the flagship youth engagement and citizen accountability system used in over 40 countries. It's also increasingly used for system strengthening around real-time monitoring systems, coordination, and various data collection activities throughout the organization, as well as other UN organizations and civil society partners.
Hi, I see that we seem to be having a problem with moving the presentations. Just give us a moment really quickly. Just a moment. Okay, great. Can you see the slides now? The updated slide, real-time monitoring across sectors. Perfect, great. All right, please.
Apologies for that.
Mm-hmm.
Increasingly, RapidPro is being used to support real-time monitoring across every sector where UNICEF operates. And really the aim of this initiative is to help strengthen the organizational capability to do these work more quickly and more effectively and at lower costs. To date, real-time monitoring activities with RapidPro have been nationally scaled, particularly in areas around water and sanitation, health, birth, and education. The adaptable system allows for the flexibility to adapt to UNICEF's changing programmatic objectives as well as the changing context in which we operate. RapidPro is designed to support with improved evidence-based decision-making, allowing for course correction throughout the program implementation cycle, reaching harder to reach populations and ensuring that the most vulnerable can be connected digitally to the systems that allow decision makers at UNICEF and in governments to address the needs of communities everywhere in the world. UNICEF's engagement with these kinds of technologies is not new. Some of the first pilots of these technologies occurred over 10 years ago, and we've now reached a point where the programmatic impact is maturing, and our capabilities have grown beyond the proof of concept phase, and we're now figuring out the additional institutional mechanisms, policies, and best practices to ensure that these solutions are able to provide value to UNICEF and the children that we serve everywhere that it's needed.
Great. So I just wanted to give just a quick background on this initiative. So UNICEF's program division, the Information Communication Technology Division, the UNICEF's Field Results Group, and the Office of Innovation, jointly with the 3 regional offices from East and Southern Africa, Middle East, North Africa, and South Asia, came together to support program delivery and national system strengthening using RapidPro in 11 countries and territories. And you can see those countries before you on the screen. So through this initiative, an integrated package of technical assistance, which is provided by regional office and headquarters colleagues, interdisciplinary teams of ICT, program planning, etc., and catalytic funding ranging in amounts of $100,000 to $230,000 were provided to the various countries, and this was enabled by $3 million in 7% set-aside funding provided by the Office of the Executive Director mid-2017. And this funding was allocated between November 2017 and February 2018 of last year to the participating country and regional offices. And country offices have also been very much supporting this work with their own available country funds and other resources, including national partner resources. So UNICEF's real-time monitoring system strengthening and scale through RapidPro initiative is an interdivisional and interdisciplinary approach to support regional offices and country offices as they design and implement programs that leverage innovative tools, such as RapidPro, to address program bottlenecks. It's a country and regional demand-driven effort using a proven innovation to help national governments track, deliver, and accelerate results for children. And when I say demand-driven, the 11 countries, they were selected very much in consultation with regional directors in these regions. The initiative aims to capture rapid lessons to support the efficient and effective scale of innovation such as RapidPro. So you all may have seen we've done a number of lessons learned briefs at 3 months of country implementation as well as at 6 months of implementation jointly with country and regional offices to capture these lessons and share them among these countries as well as with others using RapidPro technology. And this initiative supports the identification of pathways to scaling and mainstreaming innovations such as RapidPro in national real-time monitoring using innovations such as RapidPro in national programming. Another aspect is that this work has been very much aligned with UNICEF good quality programming practices and planning, and the idea and providing quality assurance support for the use of RapidPro to support system strengthening. So, for example, each country was requested to develop a country proposal for their real-time monitoring RapidPro initiative, which included developing a theory of change and expected results, work plans and monitoring plans, which were strengthened through joint regional office and headquarters support. And countries have been asked to report quarterly on their progress, lessons, and good practices in implementation. And all of this is fed into joint reviews at the country level and annual reviews as part of our normal programming practices. So there are 2 last comments I want to make. One is that, this initiative is about strengthening real-time monitoring systems. However, at the end of the day, we as UNICEF, we are technology agnostic. So we want to emphasize that, if there are other real-time monitoring platforms or solutions at the country level that are working, that are in place, that are better suited, certainly those solutions should be used. So the emphasis was not to displace existing systems. The idea is that RapidPro should be used where there is demand by partners for this platform. And also, the last comment I'll make is that we know that technology itself is not a magic bullet. It's not a solution in itself. So the emphasis of this initiative is not on the technology, but rather on the systems that it looks to support. And we know that technology is not a substitution for frontline WASH, education, or health workers and social service providers, and that real-time monitoring must be integrated into well-functioning systems at multiple levels that are able to make use of the data and information that are generated in order to make programmatic course corrections. So with that, let's go ahead and segue into the first presentation, country presentation by the Pakistan country office. Over to you. Thank you.
Thanks, Raquel. This is Aisha Durrani. I'm the Communication for Development Specialist for the Health Section in UNICEF Pakistan, and I will be jointly presenting with one of my innovations consultants.
Hello, everyone. My name is Marzia. I have been working on innovations in the RapidPro Scale-Up in Pakistan country office over the past year.
Okay. Can we move to the next slide? So in Pakistan, the project started for us in late Q2, and we initiated it with a delay because there were some issues with the government in availability of shortcode. So for that, we had to find alternate methods of using RapidPro, and that's why we were delayed for a bit. So the project aligns with our strategic plan target to reduce dropout rate between DPT-1 and DPT-3. These are a combination of vaccines which are given up to 14 weeks of age in a child. So we assess the dropout rate between the coverage for these two combination of vaccines, like how many children were dropped out up to DTP-3. So that gives us a good enough coverage rate and allows us to identify how many children dropped out. So what do we need to do to cover for that? So our target is to reduce this dropout rate. That's how we are aligned with it. So RapidPro Scale Up is actually going to be used through, we are going to use real-time monitoring with our frontline workers, health workers, monitors to see how we can ensure that service deliveries improve to an extent that community starts demanding for these services, and we actually improve the service delivery. So it's aligned to our output 3 in our country program. And in that, we are trying to see that demand for skilled care is increased and care-seeking behavior is improved in targeted communities, like I mentioned, so these are connected. We are focusing on high-risk areas where we have the maximum number of cases of missed children who miss out on basic vaccines. These were originally identified by the polio program in Pakistan, so we are building on that and trying to see that we cover them. And the impact on the other immunization program results is that when you monitor the different elements through RapidPro, you can assess what is happening at which level, where there are gaps, and how can we address them immediately so that we can improve service delivery. We are using a mixture of UReport and RapidPro. So because of the cancellation of UReport shortcode, we had to use alternate methods of social media. So I'm explaining it at the beginning because as we move forward, we will be mentioning both. Can we move to the next slide? Raquel, can we move to the next slide? So the results that we have achieved so far is through a mixture of RapidPro and social media. So for RapidPro, because of the short code cancellation, we use the app RapidPro Surveyor, and for real-time monitoring with frontline workers and our district health monitors. Whereas for community engagement, we used different social media channels and WhatsApp. So we were able to reach around 37 million children during the measles campaign. How are we connecting this to them is that 268 monitors use the RapidPro Surveyor app for different areas like urban health planning, cold chain equipment, which is transport and storage of vaccines, and then general monitoring during the measles campaign to assess how things were going. So these people monitored the situation on the ground, reported real time in the system, and the results actually helped us improve our overall service delivery. So that's how we were able to use to reach out to 37 million children in 163 districts. And we were able to reach about 31 million families of these children as a result of connecting with these monitors. So I'll pass it over to Marzia now for the key achievements.
Yes, so the 31 million families approximately that were reached, we did that through 9 surveys over the course of a year. And out of these 9 surveys, 3 were developed and deployed earlier last year for urban health planning. These were group surveys and household surveys that determined the availability of basic health services, coverage rates, and monitoring of government's fixed vaccination facilities under the program that's called Expanded Program on Immunization. 2 surveys were developed for monitoring and ongoing deployment of new cold chain equipment, which, as Aisha said, is transport and storage of vaccine. And this was implemented in some parts of the Punjab province of Pakistan. For measles campaign specifically, we developed 4 surveys. 2 of these surveys were used before the campaign for validating district microplans and monitoring trainings that were going on in each district for vaccinators, assistants, supervisors, and social mobilizers. The campaign monitoring checklist was the one that developed for monitoring and ongoing deployment of new cold chain equipment, which, as Aisha mentioned, is the transport and storage of vaccine. And this was implemented in some parts of the Punjab province of Pakistan. 4 surveys were developed specifically for the measles campaign. 2 of these were used before the campaign for validating district microplans and monitoring trainings that were going on in each district for vaccinators, assistants, supervisors, and social mobilizers. The campaign monitoring checklist was used during the actual campaign. This was done to establish use of resources for a campaign, and the financial monitoring checklist was used after the campaign was over. So collectively for all these 9 surveys, we had 268 surveyors who were doing this work in 163 districts. Next slide, please.
Colleagues, can you mute your mics? Thank you. Thank you very much.
So I'll just briefly describe the mechanism we were working through.
Okay. Can you please mute your mics, like Raquel requested? Can we go back to the previous slide?
The one before this one. Yes, thank you. So we'll briefly just describe the mechanism we were working through. The results that were being generated from RapidPro, they were reviewed and evaluated each day of the campaign by provincial and federal governments in their control rooms. They had set up control rooms specifically for viewing the data generated through RapidPro each day.
See you guys.
Thank you very much.
Okay. Now,
so using these results, the government would propose changes in the campaign strategy where required, because the review was happening each day of the campaign. And these changes were then implemented overnight and will be reflected in the next day's activities. Can we go back to the previous slide, please? Yes, sorry, we're still on this one. So the decision would be taken, and then adjustments would be made in the campaign strategy, where required. These changes, these adjustments would be done, they would be implemented overnight, and they then reflect in the next day's activities. So the data contributed significantly in strengthening the campaign and the government's regular monitoring mechanism as well. Can we go to the next slide, please? Thank you. So the oversight consultants engaged for measles campaign, they were brought together in one city in each province. This was about a month and a half before the campaign was to begin. In each province, and they were provided a day-long training on the 4 checklists that were to be used by them and the use of RapidPro Surveyor app. The trainings were held in 5 cities over a span of 10 days. And during these 5 trainings, use of RapidPro Surveyor, the app, including the overview of RapidPro itself, the surveyor, how it works, getting started, filling questionnaires, submitting entries, common problems, and their troubleshooting. We covered all of these areas. And in addition to that, each province had 2 supervisors who were also trained on the use of RapidPro dashboard. This included, using the workspace, how to access flow results, how to clean and sort data, importing data to SPSS, and the basic analysis they were required to run. Next slide, please.
Okay, so on this slide, we give you concrete examples of how the feedback actually helped us in improving our day-to-day planning or improving the planning for the next day during the measles campaign. So in Punjab, they were using the wrong syringes to basically constitute the vaccine. So the district consultants reported this on RapidPro, and immediate action was taken the next day to ensure that the right size of syringe was used. Similarly, in Sindh, the vaccinations in the vaccination sites, you are supposed to waste the needle immediately after vaccination so that it cannot be used. And some of the vaccinators were not doing that, they were just capping it. So the district consultants immediately reported on RapidPro. So we got data from different places in Sindh, which is, so all of these are provinces. So these are the 4 provinces from Pakistan: Punjab, Sindh, Balochistan, and KP. So in KP, when they found out, again, the district management and provincial management took immediate action, and the slight or this issue was resolved on the next day. In Balochistan, there was the poor quality of markers was identified for finger marking for the children. So even after 1 use or 2 uses, they were completely useless. So they asked for a new batch of markers to be available so that it could be immediately rectified. In KP, they were supposed to use cool packs to store the vaccines, whereas they were using frozen ice packs, which actually harms the medicine. So it's not usable if it's frozen at beyond a specific temperature. So that was also rectified immediately when it was reported through RapidPro monitoring. Next.
Yes, so while the process to reactivate shortcode for U-Report is underway, in Pakistan Country Office, we used other information resources like social media and mass SMS broadcast for community outreach. And like, we mentioned, we utilized RapidPro Surveyor for feedback and surveys for monitoring and reporting. So key immunization messages and those specific to measles campaign were disseminated through a digital campaign using all these platforms, including Facebook, YouTube, WhatsApp, Twitter, and SMS, and we collectively reached over 19.5 billion people. Next, please. This is just to give you a snapshot of the information dissemination happening through Facebook. We can move on to the next slide.
In terms of challenges, the first one was cancellation of the shortcode for us. It was cancelled by the government because it was used for another agency without approval by the government. So we had to use RapidPro Surveyor as an alternate in order to do real-time monitoring and feedback, because this is one of the areas where we felt it was the weakest for us, and we wanted to build it up during the measles campaign to show more results. So it was a big challenge trying to find alternate solutions in a short time, and also moving towards use of other digital media to do that. Our advice to other countries would be that looking at all the challenges that we faced, it's always good to have the government on board from the beginning, from the inception phase, so that they are aware of what we plan to do. And that's what we've done in this project now. So from the beginning, we got the government on board. We showed them what RapidPro Surveyor could do for them, and we made sure that all the surveys, all the checklists were approved by them. So they were fully owned by the government.
And in terms of the app design limitations, because the app has been the primary tool that Pakistan country office has used, and we're not sure how many other countries have used it to this extent. We do strongly recommend strengthening the app in its design and utility. Many features that are available on RapidPro through other channels, for example, through SMS, they could be made available for the app as well. For example, length of the surveys was an issue for us. The surveys had to be a certain length, otherwise there would be a lot of errors. It would freeze. There is provision for sharing photos, but it doesn't work for everyone. So initially we had incorporated this feature in some of our surveys, but we had to remove it because a lot of the surveyors, they couldn't access this. There are no drop-down menus. It would be great if there was an option to go back and correct in case of a typo or an error. And we were using WhatsApp for a lot of other exchanges, including the media, which can be done through the app if it's just these small bugs are removed. Another suggestion that we have is if a few training guides or tutorials for country offices to use RapidPro Surveyor in particular and for its basic troubleshooting, they can be made available, because currently there's very limited literature available for the Surveyor by NAIRUCA. So we came up with these ourselves, mostly trial and error, but it'd be great if some of these can be made available for everyone.
Next. Okay, this is our last slide, so we'll go through it very quickly. The alternative methods for system strengthening in our case is we invested in social media, we invested in connecting with the public, with the communities through SMS and robocalls in hard-to-reach areas or rural areas where they wouldn't have where they wouldn't be able to read the message because of illiteracy in those areas or lower literacy level. And for real-time monitoring, we had to use RapidPro Surveyor. So there are alternate methods through which you can really strengthen the work that you do. And we actually used the social media platforms of the government. So it was fully owned by the government rather than UNICEF using its own social media to promote it during the measles campaign. And for us, from the beginning of this project, we've tried to ensure that it's sustainable. So we are currently in discussions with the government, and we are trying to reactivate our shortcodes, and they will be applied through the Ministry of Health. So they are based within the ministry, they are owned by them, and they are really interested in using them for real-time monitoring and the U-report element for reaching out to the communities. So, and they have also requested that we build their capacity, so we establish a unit within the government to take this forward in the years to come. Thanks.
Thanks everyone for listening.
Great, thank you so much, Ayesha and Mazia for the presentation. It's really impressive to see the results that you all have achieved in such a very short period of time. With that, let's segue directly into the next presentation by the Nepal Country Office. Over. Antonio, can you hear us?
Can you hear me, Raquel?
Perfect. Yes, thank you.
Sorry. So, thank you. My name is Antonio Franco Garcia, and I work on the social policy team here in UNICEF Nepal. But I'm presenting on behalf of all my colleagues who have participated in this initiative. So a very brief introduction about the context and the slide that you are seeing. So Nepal is still a low-income country and is still recovering from 2 major earthquakes. Around a quarter of the population live in extreme poverty, and malnutrition rates among children remain unacceptably high. Despite being a low-income country, Nepal comes with a large portfolio of social protection programs. The Child Grant, which this program focuses on, was introduced in 2009 as a cash transfer program to support better nutrition for children under the age of 5. So on this program, every 4 months, mothers of eligible children receive a cash transfer of 1,600 rupees, around $15, to address child poverty and support their nutrition. In total, the Child Grant reaches over 500,000 beneficiary children under the age of 5, and the government is now expanding the program with the aim to reach national coverage in just 10 years. So Nepal Country Office is piloting the use of mobile-based technologies, mostly SMS and also automatic voice messages, or IVR, to support the implementation of the Child Grant program. As part of this pilot, beneficiaries of the Child Grant in 3 remote and disproportionately poor districts, where the Child Grant has just been expanded, will now receive direct messages in their phones with key messages about the program, such as payment dates and eventually awareness raising and nutrition messages, and collect feedback from them about their experience collecting and using the grants. The pilot is being implemented with the Department of Civil Registration. This is the national partner that manages social assistance in Nepal, and with NEPAN, a national NGO. So by sending these messages, this project aims to improve communication and implementation of the government's use of the Child Grant program and contribute overall to improve birth registration rates and reduce malnutrition rates among young children. And also, importantly, the pilot project also aims to compare the effectiveness of SMS and IVR to communicate with beneficiaries. So if we could go to the next slide. Thank you. So when we look at some of the early results, and just considering that this is just 1 year after implementation, less if we count when the messages have started going out, there are some key achievements so far. First, in preparation for the project, a project outline was prepared by Nepal Country Office and agreed with government and an advisory committee that meets regularly to support implementation. We also worked very hard at the beginning to set up the RapidPro ecosystem, and Viamo was recruited to send the voice messages. Nepal Country Office also organized capacity building for over 140 local government officials in the target districts and started collecting their mobile phone numbers. In districts where we're implementing the project, we have so far collected over 30,000 unique mobile phones from beneficiaries, reaching an estimated target population of 69,000 children under 5. And there seems to be some gender balance in terms of respondents, with a few more males than females. And the largest age group is 22 years old or younger. Now, our preliminary data from the first round of messages that went out on the third quarter of last year, we found an average response rate of around 22%. And initially, it seems that voice messages seem to be more effective at reaching and engaging beneficiaries than SMS, at least in Nepal. Now, regarding some of the results from the polls, we find that 47% of beneficiaries report that they spend the child grants on education and 36% on nutrition. And we also find that some beneficiaries still face challenges in receiving the cash on time. So we have just started sending the messages at the end of last year, but these are very early results. So we hope that by keep investing in the system, which will give important information to improve the effectiveness and impact of the child grant program. So if we go to the next slide. Thank you. So some of the key challenges and lessons learned and how we have mitigated them. So there are two big challenges that we found. And the first one was limited local capacity, and the second was low literacy among the target population. So regarding the first one, Nepal is still a low-income country, so governance is likely to be weaker than in other middle-income countries. In addition, the country is adapting its infrastructure and human resource capacity to translate the federal system into a reality. As a result, local government officers that we are working with and who are responsible for delivering the child grants had limited capacity and resources to cope with additional tasks. So Nepal Country Office tried to respond to this challenge by coordinating very closely with local governments and providing opportunities for them for capacity building. Now, at the onset of the project, we organized an orientation session for local governments in each of the 3 pilot districts where we implemented RapidPro. And in doing so, we managed to build ownership and support for the program. Now, the second key challenge that we encountered was low literacy and ownership of phones. So cultural diversity and low literacy can be barriers for the adoption of technological solutions. So with over 100 spoken languages, Nepal has one of the greatest diversities in the world. In addition, low literacy and technological skills among our target population is still affecting response rates. So the photo that you see on my slide on the right-hand side shows when we went to the field to collect the beneficiaries' phone numbers during payment dates. Now, many of the beneficiaries brought their phones from them or from their husbands for us to look at because they even didn't know their phone numbers. So because we wanted to communicate the specific information at the ward level, the lowest government unit in Nepal, collection of phone numbers took place at that level, which imposed big cost. So we are now reevaluating this model and exploring alternative models for collecting phone numbers in the future. So to generalize some of the key early lessons from Nepal is try to find ways to work with your target population to build their trust and address their needs. So if we can go to the next and final slide. Thank you. So Nepal Country Office seeks to build on some of the early lessons from the implementation of RapidPro to Nepal's child grant and some of the good practices for other country offices embarking on similar projects are the following. The first one, develop a strong proposal considering how mobile technologies can help you and government counterparts enhance the effectiveness of the programs and achieve results. So in Nepal, we worked quickly to set up the RapidPro ecosystem, and we are lucky that we had good support and guidance from our regional office. So don't underestimate the time commitment required, and no matter how well designed is your intervention, you will need to fine-tune as you go. The second is that there is definitely interest and momentum about our innovation work at UNICEF. And if you're able to showcase progress, you can definitely use it to improve and streamline aspects of your program and even fundraise. So we have also, in conversation with different donors, we have also managed to fundraise for similar work. So for example, building on the early implementation, we are now moving towards applying RapidPro system to support early warning and disaster risk reduction of social protection beneficiaries. So to generalize, think big, think out of the box, and work out on the details with your government partners as you go. So thank you very much. That's all from my side, and I look forward to any questions at the end.
Perfect. Thank you so much, Antonio. So now we will segue to the Zimbabwe Country Office presentation of their WASH initiative. Thank you.
Yeah. Hello? I don't think. Hello, everybody.
Hello, yes? Yes, this is Raquel. We can hear you.
Okay, thank you, Raquel.
Perfect.
My name is Moblessing Nyaka. I'll be making the presentation on behalf of the Zimbabwe Country Office, but with me I've got colleagues that have been part of this real-time monitoring initiative.
Hi, my name is Aiden Cronin, Chief of WASH in Zimbabwe.
Hello, my name is Shepard Mtsiwegota, T4D Officer in UNICEF Zimbabwe.
Okay. So in Zimbabwe, the real-time initiative is supporting work under the global goal number 4, which aims to ensure every child lives in a safe and clean environment. At country level, it is being implemented under the WASH section, which is the Water, Sanitation and Hygiene section, with support from our ICT and communication. The WASH section is contributing to increased and equitable use of safe WASH services in Zimbabwe. And one of the section's objective is to strengthen national capacity to monitor WASH services. And one of the strategies that is being employed to achieve this is establishing a platform that provides accurate and up-to-date data on WASH indicators for evidence-based decision-making. Next slide, please. UNICEF is currently supporting the establishment of the Rural WASH Information Management System in Zimbabwe, which is a mobile-to-web data platform. And in the initial design of the system, data was being collected by government extension workers whose responsibility was to go around their respective wards collecting data from community members on the WASH situation in the area. And this data was captured using a mobile device and synced to a national database. And then the data becomes available for planning online. And this system was implemented in 5 out of 8 rural provinces. And the implementation was being coordinated by the government's Information and Knowledge Management Task Force. Next slide. Thank you. The economic challenges in Zimbabwe have made it difficult for our government to support the movement of extension workers in the wards. And this has limited interaction between communities and extension workers, leading to limited or no data updates coming from some parts of the wards that are not being reached by government extension workers. So the database was basically getting out of date. In addition, we were experiencing reporter lethargy, where communities were constantly reporting breakdowns, and the information was being updated in the database by the enumerators that were receiving the information, but there was no action being taken to rectify the situation. So basically, our communities were actually getting fed up by reporting and not getting any response in terms of having the situation being rectified. So RapidPro came on board to an existing information management system where we are currently integrating RapidPro with the RIMS to provide communication between the communities and enumerators without the enumerators having to travel, as well as to provide a feedback loop to service providers. So what basically happens is that a community member sends an SMS, and if the SMS is reporting on a breakdown on any WASH facility, an SMS is automatically generated to the relevant service providers for a response to be provided. And district authorities actually monitor the time taken to respond by service providers online. Next slide, please. So in terms of the results that we have achieved so far, they include the development of the interface that integrates the existing RIMs and the SMS capabilities of RapidPro. This new system is now called the RWASH Information Management SMS Notification and Response System. And it was piloted in one district and has been subsequently rolled out in one province. The system captures WASH facilities that are being used by about 400,000 households, covering approximately 1.7 million people. And it captures various indicators across about 10,000 water points, and it also captures sanitation and hygiene in over 3,000 villages, as well as WASH-in institutions. We've also managed to conduct capacity building for government system users from national to ward stakeholders on system utilization. And in addition, we've also managed to register about 14,000 community members onto the system so that they're able to report on any changes in any WASH indicators on the infrastructure. Next slide, please. In terms of, next slide, please. Thank you. In terms of WASH results, we have seen improved sustenance of water supply. From the pilots that we actually conducted, for which we've got results, we noticed that 2/3 of SMS notifications reporting a breakdown were attended to by a village pump mechanic. And of these, 56 of these became functional. And this has helped reduce downtime in the pilot district from about 7 days to 3 days. And we have received some feedback from key informants during our monitoring, which is when boreholes were non-functional, women and children will walk between 2 and 3 kilometers in search of clean and safe drinking water. But with the RIMS SNR, all these problems are a thing of the past, as repairs now only take between 3 to 4 days. And another result that we have also noted is an improved interface between communities and service providers, where communities no longer need to travel long distances to reach service providers. And the improved communication between the service providers and communities has also contributed to ensuring that WASH services are sustained within the respective communities. And we've also received feedback on this issue where one of the key informants also indicated that the SNR system has made life easier. I do not need to travel to look for the village pump mechanics at the numerator. I just use my mobile phone and SMSs are for free. Next slide, please. Thank you. We've also noticed that provinces and districts are reporting improved access to data for planning. For example, we have got in Caesar district, where the SNR component was piloted. They've used this data in the development of their 2019 annual work plan. And we also received feedback from a member of the Provincial Water and Sanitation Committee in the province. And they've indicated that this has helped us in terms of decision making. When targeting, where interventions are needed, we utilize the data on RIMS for task targeting. We can easily identify where there is low water and sanitation coverage. This is feedback in terms of some of the improvements and how they've managed to utilize the data, because the data that is now online is up to date as a result of using the RapidPro initiative. And in terms of some of the challenges that we came across in implementing the SNR component. We used the cascade training to reach all stakeholders, and one issue that we came across was that the cascade training was not as effective as we had expected, as we noted that some of the risk members were still not registered on the platform, and we could also, during our monitoring of the system, we also noted low utilization of the system by risk members. And currently we are planning to have a review meeting with all the stakeholders that we actually trained, so that we can come up with recommendations on how to reach full district water and sanitation and provincial sanitation committee members with the training, so that we actually strengthen areas where the cascade training was not implemented well, to ensure that the system is actually fully utilized. And then another challenge that we're currently facing is related to the economic challenges that we're currently going through as a nation, which has resulted in the high cost of SMSs, which may affect sustainability of the system. Currently, the cost of SMSs is being shouldered by UNICEF, but we do expect to be handing over the system to our government partners, and we want to ensure that the cost that is being handed over is actually manageable. So currently we have discussions that are underway to manage the costs, the high cost of SMSs that we're currently experiencing. And one of the ways that are being discussed is limiting the number of indicators that need to be updated monthly through the RapidPro platform. This will help reduce the SMS traffic, and hopefully will reduce the cost if we rationalize on the indicators that are being updated monthly. And also we are trying to engage the responsible ministry so that we also liaise with the mobile network operators to provide a discount or a zero rate on SMSs that are being sent through the national system as part of their corporate social responsibility. Then in terms of some of the lessons and good practices, for the good practices, I think this has been alluded to by the Jordan country offices, where involving all government stakeholders in the establishment and development of the system is actually a good practice, as in the end, they will fully own the system. Like in our case, this is basically a monitoring system, a database that is coming in place to replace paper-based systems that were being used by the various departments in the ministries that are responsible for WASH. And for the system to be fully utilized, the government stakeholders really need to be on board, and involving them right from the beginning, from the establishment, and identifying the indicators and the data collection methodologies, I think has been very useful in ensuring that the system gets the green light for utilization by the ministries. And another good practice is relates to the pilot that we actually conducted, where we started small, we learned before we then scaled up to the province. And this has actually worked quite well in our case, as well as the collaboration that we've had across the different sections, the WASH, which is under programs, as well as communication and ICT. It has synergized the learnings, and it has synergized the way that we actually conduct and how the system is rolled out to bring out good results. And then one of the lessons that we actually had in the implementation was the need for us to engage mobile network operators very early on in the process to iron out some access issues. We had an issue where the mobile operators were on board, but they were having difficulties in getting onto the RapidPro platform, and that took us some time for us to solve the technical issues to enable the rollout of this, to enable the rollout of the system. and that had somehow derailed the timelines that we had for implementation. Thank you.
Thank you very much, More Blessing, and Aiden and for Shepard who are with you. When we get to the Q&A, please note there have been a number of interesting questions for the Zimbabwe Country Office, which we can get to in the Q&A. Oh, I'm sorry, do you have one more slide, More Blessing?
I had already gone through it.
Sorry for that. Okay, so for now, we will proceed with the Uganda Country Office presentation. Alex, are you on the line? Okay, muted. Alex, can you try to speak and see if we can hear you?
Yes, please. I can hear you loud and clear. Can you hear me?
Perfect. Yes. Thank you.
Okay. Thank you, Raquel. My name is Alex Muhereza. I'm a health specialist and with supporting health information systems with the UNICEF Uganda country office. I'm presenting on behalf of the country office, and I'm in the field actually supporting the taking off of the activities for the RapidPro initiative track that I'm going to present about. And with me is Alfred Asemukasa, who's from the regional office. We're actually in the field supporting the user acceptance test for MTRAC. Just to mention that our network has been intermittent, and you'll bear with me in case the network goes off or anything happens. Just to kick off the presentation, using the support from 7% set aside, we were supporting the upgrade of a RapidPro based tool, or I mean a Rapid SMS based tool known as MTRAC. MTRAC was born from the need to have real-time data availability with health managers in Uganda, and through strengthening the existing paper-based health management information system. This was about 9 to 10 years ago, and at the time, Ministry of Health Uganda approached UNICEF to see if there's a way where the technologies at the time could be used to collect information on disease surveillance and stock management, particularly to support weekly reporting at a health facility level, and also ensure that information is available across the sector levels, that is from the health facility to the district and the national level in the shortest possible time. MTRAC was piloted back in 2009, and implementation took off in 2012, and national scale across all the districts for Uganda was achieved in 2015. This set of support within the country office is housed under the Child Survival and Development section, and our first output, which focuses on reproductive, maternal, born, and child adolescent health, and is housed within the Health System Strengthening Unit, which looks at implementation of the district health system strengthening. And this is basically to support districts to be able, or district local governments to be able to plan and develop evidence plans across a financial year, whereas using information. However, this information has to be made available, and MTRAC is one tool that the country office was supporting the Ministry of Health to ensure that this information is collected and made available. Now, within the health management information system, reports are collected on a weekly basis, on a monthly basis, quarterly, and an annual basis. Now, of course, the initial set of data collection is based on a weekly basis, and it was important that at the time, there's an accountability at the health facility level on the patients that the facility has seen, the drug stock available or the drug status available at the health facility. And this information is where most of the other reports that the health facility uses to serve its patients is generated from. And there was a gap that the data transmission from the health facility up to the national level, there was a gap, and there was need to ensure that that gap is bridged. And this is how MTRAC was born. Now, MTRAC is a rapid SMS-based tool, which is which uses a set of 8 messages, and these 8 messages are within a weekly report that you know within the Health Management Information System as the 033B. And this information cuts across about 65 data elements, which look at disease surveillance, drug status, drug stock status, which includes antimalarial drugs, tracer medicines, HIV testing kits, looking at drugs that are used to treat drug resistance TB, but also looking at the number of patients within the outpatient department that come at health facilities, ranging at least a set of 60 diseases. And then it also looks at the ability of the facility, the capacity of the facility to be able to support these patients and to see if these patients are being tested and treated. So all this information is sent using MTrack, using a set of 8 messages. So this tool has been in use for the last 7 to 8 years nationally, and a lot of feedback had been generated on a few gaps, including data quality, ability to manage thresholds, also the ability to transmit the information in real time as agreed within 3 minutes. When RapidPro was adopted by the Uganda country office, it was an opportunity, it provided an opportunity in which some of this feedback and the challenges with using MTrack based on rapid SMS could be addressed. Also at the time, the paper-based health management information system was being reviewed. Every 5 years, Ministry of Health Uganda goes through a process whereby the data elements, the indicators, and the reporting tools based within the HMIS are reviewed to ensure that they are realigned to the needs of the sector, but also to the national M&E framework. So this provided an opportunity whereby also we could upgrade MTrack to ensure that the feedback and the challenges we were facing in use could be addressed. For example, in the last 7 years, our reporting rates had never were at an average of 78.9%, which was a little bit below the WHO recommended rate, and this was largely due to the ability that the fact that there was a struggle in understanding of the data sources for the weekly reporting, and also the capacity of the health workers to send this information using on rapid SMS MTrack, but then also MTrack rapid SMS based MTrack had a few areas where messages could be sent through, but because of the ability to link up with the network service providers and also the servers back at the ministry, there were a few areas where this information could break down. And also the data quality within to be transmitted and understood by rapid SMS, the rapid SMS engine, in a way sometimes it failed. So with RapidPro and 7% set aside support, we took on the opportunity to upgrade MTrack from the MTrack SMS engine from Rapid SMS, RapidPro. And this was to ensure that, one, we adapt the data quality measures within sending or reporting of these indicators and SMS, but also to ensure that we capture the revised HMIS within the revised HMIS data elements and tools within MTrack, so that in the next 5 years, health workers are able to report using the latest or the aligned HMIS tool. Now, MTrack is available across nationally, as I said earlier, that is in 128 districts. And we have over 39 health workers registered in the system and in the tools using it to send weekly messages. As of today, we are currently at an 81.2% reporting rate, up from 78.4% last year and the 64% the previous year when we were initially thinking on taking on or upgrading it to RapidPro. MTrack also has additional functionalities. Raquel, next slide, please. Sorry, forgot about that. MTrack also has additional functionalities, which include, one, collecting health service delivery feedback from the community members, and any community member who has health service delivery feedback, be it a complaint or compliment on the services they are receiving within the community or from these health services is able to send in this information in real time via an SMS code. All services are free to end users, and on an average basis, on a month, we receive at least 278 reports. And of these reports, at least 70% of them are followed up by districts, are investigated, and feedback is provided to community members on the results. These reports could cut across feedback. We've seen a lot of feedback on probably working hours of health facilities, some areas where health facilities, there's drug stock. We've seen also overtime during MTRAC use, we've seen compliments tend to increase by at least 30% on the service that the community is receiving from the health workers. But there's also, in cases, the absenteeism where health workers have not been showing up or opening facilities or being in time, also we've seen such major reports. And these reports are initially assigned to districts who then follow up, and as I mentioned, 70% of them on average have been resolved, whereas at least 25% of them have been scaled up, are escalated to the national action centers, who then follow up and are able to advise. And of course, at the time when MTRAC was being adapted using rapid SMS, there were no policies or set standards within the sector or within the country that we were, or guidelines that were following. And with the support we received, we've been able to, they've acted as a catalyst within the sector to start operationalizing the draft e-health policy that we have. And this has been through thinking of developing initial steps for preparation of development of an enterprise architecture and a health information system exchange framework. Also, including, we've provided support to develop a health information system strategy. All these are documents, guidelines, and strategies geared through setting standards for health information systems management within the sector, and also ensuring that at the end of the day, there's uniformity in accrediting health information systems, and at the end of the day, there's a one agreeable data collection and management support, but also to ensure that there's acceptability by stakeholders and there's data utilization. And of course, through our district health system strengthening support, ensuring that there's real-time data for health managers, we've been able to see districts utilize information from MTRAC. Particularly one example that stands out is drug redistribution among health facilities within a district, where we've seen DHOs transfer drug stock from one facility where they are seeing a low outpatient data burden to higher facilities where they are seeing a higher outpatient burden with no drugs, are using information they've generated on a weekly basis from MTRAC. Next, please. Then also, among the challenges we faced and lessons we learned was, one is that with MTRAC, it's a national owned initiative which has already been, at least 85% of it has already been handed over to government, and UNICEF is providing technical guidance with support from WHO. And this means that government is heavily involved. Now, since there was a health management information system, or the paper-based was being revised, this had to be concluded in order for the upgrade to take off. And in this delayed us at least by about 5 to 6 months, given by the timeline that we had agreed earlier, since some of the tools that were being generated, including the weekly report, would actually input into the upgrade process. And initially, essentially, we were looking at upgrade of MTRAC as a tool, but then MTRAC has already been integrated with DHIS2, and there was need for Ministry of Health to ensure that one, MTRAC and DHIS2, which are the national accredited health information systems, move together during this upgrade process. Even currently, as we conduct the user acceptance test, it's both for MTRAC and DHIS2. So there was expansion of scope than earlier planned, and of course, that meant more stakeholder management, which was also a challenge. And then, of course, during this previous year in 2018, there's been new Ministry of Health structures. Roles have been interchanged in between. And there's been need, for example, to strengthen, build the capacity of these roles to manage the two information systems, but also operationalize the data center where the information systems are being hosted. And all these were requirements before the app code could take place or before the information system could be deployed. I think our biggest lesson as a country has been need to have a strengthened governance and coordination mechanism by government because one, this helps in management of scope. We've learned that this helps in management of the scope for the information system, for the process, and ensuring that the various components that were contributing to the upgrade, to the revision of the HMIS are coordinated and aligned to the health sector needs. I think that was our biggest lesson. Then next, next slide, please. Good practice, one which we would like to share with everyone on the webinar, is that there's been a lot of standards out there, including the OpenHIA and the rest on the health information exchange, but limited demonstrated cases of health information exchange. And in Uganda, we've been able to demonstrate a case between MTRAC, which is a RapidPro initiative, and DHIS2. And this means we'll be in real time, MTRAC is able to exchange the information it's collecting and make it available in DHIS2. And in addition, with this support, we've developed a smartphone Android tool that we are providing as an option for health workers and district level health managers to review reports for quality control and ensure that these reports are synchronized into DHIS2. So that is basically our demonstrated case and our good practice, which we would like to share with the rest of the team. I forgot to mention that this all support has been with my colleagues at the Health System Thinking Unit and the Child Survival and Development Team. Thank you very much.
Thank you very much, Alex. It's really fascinating to learn of your experience and process, and and how the scope of this work shifted and increased somewhat, and how you all are managing to align the ongoing work with the emerging and shifting government priorities. So thank you for that. The last presentation today will be of the Jordan country office. I realize we're a bit late in time due to some of the technical issues earlier. So I'm proposing that we go to about 10:45 and stop there. Evan has shared a knowledge management page where this webinar recording is going to be uploaded. We also have a Yammer group, a real-time monitoring information Yammer group, which we will also add you all to, so that we can continue these discussions and you can ask questions. So with that, over to Alexis. Thank you. Hi, Alexis. Can you speak? I don't know if you can. Can you hear me? Muted, Alexis. No. It is.
Hi everyone. You can hear me, I assume, right now?
Perfect. Thank you.
Perfect. Thank you. So let's go to the first slide, if possible. Thanks. So I'm Alexis Bonsen. I work as a social protection officer for monitoring and evaluation in Jordan country office, and here I'm going to present you the initiative of real-time monitoring that we've been and how we've been using RapidPro for Jordan country office in the Hajati Cash Grant program. And how we've done that, we've agreed already on the use of real-time monitoring with the National Aid Fund, which is the main social protection institution, and we'll go a little bit afterwards, we'll go onto that, so that they can implement RapidPro within their own social protection program. But first of all, and in order for us to build the ownership of the institution and to ensure that we could provide relevant technical support to the National Aid Fund, we've been implementing RapidPro within the Hajati Cash program with two objectives. Most of it, first, is a risk mitigation strategy as part of that we can adapt the intervention quickly in an environment that is moving really fast. This cash program that we're implementing covers currently 3,000 families with 10,000 children, but it used to cover 55,000 children. And it provides also an accountability channel to complement the helpline and also Facebook page that we have within country office, so that it can provide us on real time information about the program and the issues that beneficiaries are facing. We've been using to verify that assistance was reached to the right beneficiaries and troubleshoot most common problems when receiving cash assistance. It's important to signal that we in Jordan have the chance of, we have the benefit of a good level of infrastructure. So for instance, we do not rely on cash on hand, but on ATM machines to retrieve the cash assistance. But on the other hand, the beneficiaries that we're assisting, even though they may have access to cell phones, they're still most of them are Syrian refugees with low knowledge of what we could say basic infrastructure. So we troubleshoot, for instance, how to use an ATM directly with the beneficiaries. Next slide, please. Okay, so what we've done so far is reaching 4,025 families, representing more or less 14,000 children from August to December. Here is the first thing to flag out, is that even though we started the project 1 year ago, we were really able to implement it and send SMS starting in August 2018. We have had a very high response rate, 16.2%, and what we analyze out of this is mainly due to the fact that, as I was mentioning before, there is still good infrastructure in Jordan, and our population, even though not that tech-savvy, let's say, they still use SMS, and mostly they use their cell phone mostly to communicate with the other side of the border, with the relative that stayed in Syria. We have been able to validate data for approximately 2,000 families, some basic data about the children, so that we could adapt also our cash assistance, since it changes depending on the number of children. And we did so with saving 75% more or less of the cost of what it would have cost us to go on phase-by-phase update of data. We have generated some really insightful results on the programs, which you can see below in the illustration, in terms of beneficiaries that know the purpose of the program, or satisfied with him, or that are helpful, how the program can be helpful to in a educational outcome. And all of this we started passing on in October, November with the National Aid Fund, that already was trained twice on the platform, and that integrated the RapidPro as a way within its expansion plan, which is a project that the World Bank is financing to raise the number of beneficiaries of cash assistance by 60% in the next 3 years. So that would require a much bigger scale up by the National Aid Fund, in which they would need to use communication for people to register for the cash assistance. Next slide, please. So two challenges that we wanted to highlight, and I think also some colleagues have referred to them before. One thing, and I was mentioning in the previous slide, it took us 8 months to send the first two-way messages. What happened there is to seek all the approvals and authorization and procure efficiently took us 8 months. But what happened is that we felt on the programmatic side very frustrated because we were ready to roll over after 2 months of the program, but we had operational constraints, and what we learned is to be very aligned with not only colleagues into the office, ICT and supply were really supportive, but also in seeking all the approvals and making sure that the partners, mostly for instance the SMS aggregators, are aware of what we want to do. So that the rollover can go, the programmatical rollover can go in hand with the technical handover. On the other side, another challenge that we had was due to again to technical implementation, in which we had to really understand on detail the platform and the RapidPro environment, and make sure that and we've done some mistake on it, on which we learn. But one rule of thumb right now is that we have been testing over 3-4 times. Whenever we have something ready to go, instead of pushing the last the button to send, we do a final test check with approximately a group of 5-4 person out of the office that have not been working in the project, so that we can see that effectively it works as we intend to do. Next slide, please. One last thing on the good practices was how we've used the Hajati program, which is a reasonably medium-sized program for UNICEF Jordan country office, and leverage on this program to expand into other section in the country office. What we did is really constituting a team of 3-4 member that are now aware of all the issues with RapidPro, and we always work in a group. There is no one that does one thing that the other doesn't know how to do. And we follow up on what we do so that we can learn from each other's mistakes. So we call ourselves right now the gurus of RapidPro, and once once we have been able to showcase the results to management and to our own offices, we have raised interest within Jordan country office and within the National Aid Fund, so that we can leverage on our current knowledge and start build up with other section depending on the need, and using different let's say ideation plan on which we could solve issues that some section or some other institution would go through us. Thank you very much.
Great, thank you very much, Alexis, for your presentation. And I know you're doing double duty in Bangladesh as well. So I want to open it up to questions. Now we've received a number of questions that have come in, and perhaps we can proceed first with some of the questions for the Zimbabwe country office. So I'm unmuting Aiden. Your mic right now, and there were some questions about, some of the specific information or indicators that you are monitoring in the WASH for the WASH initiative, as well as are you seeing the number of repairs increase as borehole repairs in terms of service delivery, etc. Over.
Okay. Thank you very much, Raquel. In terms of the question on indicators that are being collected by the Rural Wash Information Management System, under water supply, we are collecting information on type of water source, the functionality of the water point, its protection status on whether it's protected or not. We are also collecting information on water palatability, seasonality, and the availability of water point committee management, as well as households using the water point as a primary source for water. And then under sanitation and hygiene, we are collecting information that pertains to the availability of sanitation facilities. And then this is disaggregated by type so that we can distinguish those that are safe sanitation facility types and those that are not. And then we can use the information to calculate the percentage of households that are using improved safe sanitation, as well as collecting information on the availability of hand washing facilities, as well as availability of other hygiene enabling facilities such as pot rakes and refuse pits. And we can share the link to the information management system. It's actually online and it's available to anyone upon registering. It's administered by our government colleagues in the Ministry of Water.
Great. And the question of are we seeing repairs increase? And there was a second element around, I think, with increase then are we seeing the persons responsible for the repairs getting swamped? So we are seeing increase in repair because the repairs are happening more quickly. We probably don't have a long enough database yet to be able to properly quantify that. So only recently scaled from the district to the province. But that's definitely is a good point that Matthew has raised. We need to really track that over time to then be able to also make some value for money calculations with our donors, etc. The borehole repair persons were trained by UNICEF. Those are village pump mechanics. So they have actually a more geographical boundary rather than a number of boreholes. So generally we've tried to keep those ratios pretty manageable. So it's more about the time rather than the burden of repairs. And I think there was one last question that Shepard will answer.
Thank you, Aidan. So there was a question on challenges first due to the cascading process. We must explain that due to budget limitations, only 5 members out of the 20 or 25 member district committee were able to attend, or we could afford to attend the face-to-face training of the RIMS, or Rural Wash Management Information System. And the process thereafter was that they were going to cascade, or they went on to cascade the training to the lower level, which is the ward and the village. And with any process like that, most of the information or the standards required is lost in translation. So we noted certain challenges, like what the presenter initially said, where the quality, some of the quality in terms of registration or following procedures were sort of compromised using that cascading process.
Thank you, Raquel. Over from us.
Great, thank you. So now I wanted to follow up with the Nepal country office. There was a question earlier in the chat about the possibility of getting informed consent for participants. So I'm wondering if you can speak to that question as well. Over.
Thank you, Raquel. So just very quickly, we had a discussion about it, and in the end we decided to prepare some posters and pamphlets that we printed and were located during collection sites at the places where we were collecting the phone numbers. And there we informed beneficiaries that we were collecting the phone numbers for this purpose. We asked for their phone numbers if they wanted, and giving them the option that this is just optional and you may not give us your phone number. And then finally, I think it's also important when you send the text messages, give them a way out. So that's what we did. Thank you.
Great, thank you very much. I'm wondering if any of our regional colleagues, there were some questions about what tools would you look to use for different type of initiatives. And who do you go to get to request this type of support? at the country level. So I'm wondering if some of our regional colleagues, Wojciech had already begun to speak to this a bit, but I'm wondering I'm not sure if he's still on the call, but perhaps Alfred, you're also together with Alex. I wonder if you or if Rosa or other colleagues would like to speak to that. Let's see. Hello, Alex?
Hello?
Hi. Yes,
Hello?
Alfred with you right now?
Yes, please, just a minute.
Perfect.
Hello?
Hello. Yes.
Yeah, this is Alfred. I was trying to unmute my mic and it wasn't unmuted.
No problem.
Okay. Yeah, about the question, I would refer to the very good answer given earlier by Wozniak about it would best, since most of the tools are not really designed to fit any use case, and each of the tools has a particular strength and other weaknesses, and different tools would really fit different contexts and different use cases. I think it's important to work with the regional BAs and the support technical teams to base the tool selection on each particular context and use case. It is very important, and like you said earlier, to be very aware of the program needs and a particular problem and use case for which a technology solution is being deployed. It is important to have the tools come at a second or third consideration where we use the technology to really fit a well-defined problem. I would recommend that while it is important to give general information about the tools, and I think is available and we can compile that, it is very important to always focus on the program need and use cases first. Over.
Great, thank you. Thank you very much, Alfred. It's very helpful to have that regional perspective. We have about 2 more minutes. There's another question from UNICEF USA. Is there a more detailed overview of how RapidPro technology works and how it's different from other platforms, etc.? My colleague Evan Wheeler will respond to that. Over.
Yeah, we'll definitely update our knowledge management site with some additional resources on that specifically. There have been some third-party assessments that do some comparisons of these systems that we can provide links to, as well as some of our information on the capabilities. So we'll make sure that access issue is fixed for that site, and we'll make sure those materials are available there.
Great. And I am mindful of the time, and it is very late for some of you around the world. And I really want to thank you all for your participation. We've had about 190 colleagues on the line during the course of this webinar today. And so thank you for staying with us. And thank you, country offices, all of you, and regional offices for supporting this work and sharing your experience, which we will continue to do over the coming months. So we'll be doing an update, kind of an end-of-year progress report update of consolidated experience. And again, this is 1 year of experience. So we have a number of countries that are in the pipeline that are also looking to deploy RapidPro for RTM and are working with national partners to do so. And we'll be learning from their experience. Again, we have a knowledge management page. Apparently, at some point, I think it was open to externals, but perhaps with our settings, we have to change. We have to make an adjustment so you all have access. We also have this Yammer group around digital monitoring system strengthening, and I encourage you all to continue to ask your questions there, and we will help support follow up and make sure your questions get answered. Thank you again, and we'll be sharing this presentation with you all very soon. Thank you.